Happy Friday, everyone. You're watching Atlanta and Company. I'm Christine Pilara. It is so great to be with you today. Dr. Daniel Shapiro is the Medical Director of Reproductive Biology Associates and My Egg Bank North America. He's here today to talk about the unique partnership between these two wonderful entities. Good morning.
Hey, Christine. Good
Welcome
to see you again.
back.
Thank you.
Such an important thing to talk about, so I want to dive right in. What is the connection between RBA and My Egg Bank North America?
Reproductive biology was founded actually 31 years ago by Doctors Cord and Massey, and has been providing IVF services in Atlanta for that entire time. About 7 years ago, our lab director, Peter Naj, was able to bring a new egg freezing technique to our practice at RBA. It's called vitrification. It's rapid egg freezing, and it's very, very efficient. It makes it possible not only to do fertility preservation, but it makes it possible to bank donor eggs. And people don't realize how much egg donation goes on in the United States. There's at least 20,000 cases of egg donation per year in the U.S., and actually maybe more than that because a lot go unreported.
Right.
And traditionally, people get a fresh egg donor, which means that they go through treatment at the same time. The eggs are collected and then inseminated with the husband's sperm, and then the embryos get put into the recipient all at the same time.
Right.
But with My Egg Bank North America, you can freeze the eggs and then use them whenever you want. So 6 years ago, we began egg banking, and about 4 years ago, we divided that part of our practice off, and we called it My Egg Bank North America. We added 4 other practices that help us produce eggs, and they're nationwide.
Wow.
And then we have about 85 practices nationwide that use the eggs to help their patients achieve pregnancy.
Fantastic. Well, especially good for people who, let's say, are single and they want to know, down the road they're thinking, I want to have a baby eventually.
Sure.
So this is just another way. In fact, I have a cousin, 48 years old, pregnant with her second child, single, wanting a baby, and she used egg donation.
Sure,
so,
right.
Yeah, it's a lot more prevalent. I think it wasn't really talked about for a long time.
That's right.
I guess we didn't really realize that the percentages are really high of people doing it.
There's a lot of people doing it, and part of that's demographic change as women in the workforce have delayed childbearing till later and later. Certainly most are fertile right up until about age 40, 41, even 42 or 43. And everybody knows somebody who's 46, 47 who got pregnant on their own. That certainly does happen. But for most women, the egg supply runs out by about 42 or 43.
Right.
And if they wish to become pregnant beyond age 43, the only efficient way to do it is with egg donation.
Absolutely. And let's talk about if interested couples have to become patients of a network practice in order to do that.
They do have to become patients of a network practice, but here in Atlanta, RBA is the founding practice.
Perfect.
And we have the largest supply of eggs within the network, so anybody coming to RBA would have no problem getting a donor match within several weeks.
Oh, fantastic. And what patients would benefit from My Egg Bank?
Well, now, the egg bank has several facets, so people seeking an egg donor would certainly benefit because it's way less expensive than regular egg donation, fresh egg donation. The donors are readily available, and it can be done on the recipient's schedule. So the recipient doesn't have to wait for the donor to be ready because the eggs are already banked.
Right.
But patients who want to freeze their eggs for future use can also freeze through a partner practice. So if a patient wants to freeze her eggs for her own use in the future, she can come to RBA and we can provide the service the same way we do for egg donation.
Fantastic. And what is the difference, or how is it different, the My Egg Bank North America?
Sure. Well, most egg donor programs are contained within IVF practices. And My Egg Bank is different. There are 4 other egg banks in the United States, and My Egg Bank is different because we're a multi-supplied network. We have many practices producing eggs, and anybody who's affiliated with the network can get eggs for their patients from any one of the egg sources. So you don't have to be in Atlanta, you don't have to wait, it costs less, and this is true in all of the network practices.
Okay, so let's talk about the highest reported pregnancy rates achieved through it.
Sure. Now, egg donation typically works about 55% of the time. That's the national average, and it hasn't changed for 11 years. Some people do report slightly higher pregnancy rates than that, but that's because they're doing genetic testing of the embryos, and it costs a lot more to do that.
Right.
And though it makes each attempt more likely to succeed, it costs way more.
I'm sure.
And there actually aren't more deliveries by doing the testing. But we achieve equivalent pregnancy rates to fresh cycles, and actually if you use eggs from RBA at RBA, the pregnancy rates are closer to 60%.
Wonderful.
So we're very proud of what our lab has been able to accomplish. And in addition to very, very high success rates, we also transfer, on average, only 1.2 embryos. Of course, you can't divide an embryo.
Right.
But the average is 1.2. That means that we have very few high-risk pregnancies coming from the bank. Almost all of the deliveries are singleton deliveries.
Ah, fantastic. How about options in terms of money or finances?
Sure.
Because that's one thing a lot of people may think, I really want to do this. Is it going to break the bank?
It is expensive, but it's way less expensive than fresh donation.
Okay.
We work with a company called Capex MD that helps with financing. We work with another company called ARC, and all of that information is obtainable through our practice. We also have certain guarantee programs within our practice that take some of the risk away from patients so that the anxiety that's associated with spending a lot of money for fertility services can be minimized by offering one of the guarantee programs.
What about companies like Apple who are doing that for their employees?
Right. Now
$10,000.
that's the new wave.
That's incredible.
That's for fertility preservation. So that's a great idea. It's a way to take professional women and encourage them to take care of their reproductive needs in the future and still build their careers for Apple and for Facebook at the same time.
Right. Right, and let's talk about, you seek out the highest donors, highest quality donors. Talk a little bit about the screening process.
Sure. Now, the screening process is, some of it's mandated by the FDA, so we're overseen by a government agency to make sure that we're doing this right. The first and most important thing is that these donors have no genetic diseases that are common. There's some rare ones that you can't detect, but the common diseases we screen out, most notably cystic fibrosis and a bunch of diseases most people haven't even heard of before, but CF is the big one. We make sure they have no infectious diseases. They go through psychological testing to make sure that they have no psychological diseases or any risk factors for themselves or for subsequent children. And then we make sure that they're going to make healthy eggs. And there's testing we can do to confirm that as well. Our primary goal is to make sure the donors are very well taken care of. So the screening is to make sure that the donor is going to produce high quality eggs, but it's also to make sure that the donor is not at risk from the process. Right.
Fantastic information. Always love having you guys on the show. So important, and we appreciate your time. If you would like more information on My Egg Bank, North America, thank you, or Reproductive Biology Associates, please visit myeggbank.com or call 404-257-1900. And this segment was paid for by Reproductive Biology Associates. Thanks.